Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society, and I'm joined today by Dr. Samar Al-Kudari. She's an associate professor of epidemiology and clinical and translational science at the Institute Graduate School of Public Health at the University of Pittsburgh. She's a current member of the Board of Trustees at the North American Menopause Society, but more importantly, she's a fellow at the American Heart Association, and she's a research expert on menopause and cardiovascular or heart disease, heart and stroke. So who better to talk to us as women, as patients, about heart disease, which remains so important in terms of one of our leading causes of death. Thank you for joining us today.
Sure. Thank you, Marla, for having me.
So as women, it's important for us to know that there has been a link for many years between menopause and heart disease. So as women, what is it that we should know about the main characteristics that are associated with menopause that are then relevant to the risk of any type of cardiovascular disease?
Yes, that's important for us as women to be aware that there are specific characteristics of menopause that make us at higher risk of cardiovascular disease. I would start by the age at which we become menopause. So the earlier that age, the higher the risk of cardiovascular disease. We know that if you are Black, if you are Hispanic, if you have like a short menstrual cycle or a smoker, women, you expected to become early or to have your menopause at earlier age, which puts you at higher risk of cardiovascular disease. Another feature of menopause, I would say the perimenopause stage, and this is when you start your menstrual cycle to start to become irregular, and it's usually extended for 12 months after your final menses happening. During this period, women really become, vulnerable or at higher risk to experience such changes that could impact their heart health in particular. We know that they, affected in particular when it's come to their vessels as well as their heart. So that's another time specifically important that, has been linked to cardiovascular risk or heart risk. The other feature that I want to mention about is the hot flashes and the vasomotor symptoms or hot flashes or night sweat, which actually women experience as they transition through menopause. We know that, the more you experience these kind of symptoms, there is a link between that and your lipids as well as inflammatory marker. So there is a link with increased cardiovascular disease with these symptoms. And finally, level of estrogen. So the lower the level of estrogen, which is the marker of menopause, it's expected to have, an increased risk for traditional risk factors such as lipids or insulin and glucose as well.
So you've mentioned a lot of these changes that happen that can impact on our metabolic health and our heart health. But I guess the question for women is how much of that is related to what's happening with the menopause itself, and how much of it is just simply a factor of aging alone?
Yeah, that's very important question. And now we have, a better idea of what aspects of the cardiometabolic health could be menopause contributed or related, or menopause has, impact more than aging itself. I would say bad cholesterol or bad cholesterol seem to be increasing as women transition through menopause. Another aspect I would say also the change in where you store the fat in your body. It seems that women become more able to store fat in their abdomen or central fat, and that has been shown to be linked to menopause in particular. There are changes related to the vessels health. Your vessels seem to become, weak and vulnerable during this stage, and these changes that happen to the vessels seem to be related to menopause. And then we have something called the metabolic syndrome, which is a constellation of factors, including blood pressure, glucose, and cholesterol, as well as central fat in your abdomen. We are seeing an increase in these constellation as women transition through menopause that contributed to menopause in particular.
So, the news there is that if it's related to menopause and the bad cholesterol is going down, are we rescued by our good cholesterol? What happens to our good cholesterol as women transition through menopause?
So, unfortunately, it seems really that we still need to do more work to understand that, because we have been thinking that, as good cholesterol go up, you are good and you are protected. But the new studies actually showing that the measure we are using actually for measuring the good feature of good cholesterol may not reflect what we want. And actually, it may not consistently show that you are protected from heart disease. We are now trying to tackle other measures, such as, the shape and the size of these particles that carry the cholesterol in your body, as well as whether these particles do a good job in removing the cholesterol from the arteries outside the body. So these are the new measures that we are now studying and try to see if it's really impacted by menopause. Unfortunately, it is impacted by menopause, and we are seeing changes in these metrics as well. So we still need to do more in order to understand better what's going on with good cholesterol.
So you've talked to us a little bit about the fact, and women will tell me this all the time, their weight is the same, but now it's sitting in the middle, that redistribution that you've mentioned. But there's the concept of fat around the heart, which is different than fat around the middle. And how do we explain that? Is it because of the fat in the middle that is closer to the heart that now we're seeing heart fat? And the concept of that heart fat, is that itself also a greater risk for heart disease?
Yes, heart fat has been, emerging like something novel, a novel risk factor for heart disease. And heart fat, is expected to happen when you have a central fat. Because it's once you start to store fat in your abdomen, this means that your ability to store fat in other areas extended. So now the fat go to other organs, including your heart. So you expect to have more fat around the heart. And we found postmenopausal women unfortunately would have the fat around the heart higher than premenopausal women. The fat around the heart seems to be important because it's very close to your heart and it's actually active. It can produce some sort of inflammatory marker, directly can proceed into the myocard, the heart muscle itself, as well as the vessels. That's why it seemed, it has been, the attention of our researcher increase because of the local effect of this fat to the heart directly.
So we like to tell women that it's not all bad news, that here we're hearing that there are changes that happen because of the menopause itself. So once we're enlightened that these changes can happen because of what's happening in our loss of estrogen and menopause, how can we empower ourselves as women to be more aggressive about our metabolic risk factors, heart fat, that fat around the middle? How can we really fight this?
I think we can fight this by recognizing that this time of our life is very critical when it's come to heart health. If we know that and clearly know that we have, something going on during this period, if we never, have practiced healthy lifestyle, it is the time really to do that aggressively, to control your diet, to stop smoking if you are smoking, to maintain healthy weight and to be as healthy on all aspects as possible, because really these simple things seem to matter and work according to studies we are seeing, and it will definitely reduce your risk from cardiovascular disease and possibly reduce the fat around the heart as well when it's come to being physically active.
So before I let you go, is it safe to say that it is never too late to adopt a healthy heart lifestyle, introduce exercise, stop smoking, and make some of those changes that you've suggested?
Absolutely. The fastest you can adopt this kind of healthy lifestyle, the better you are. And I'm sure you will have a healthy heart for sure. Yep, absolutely.
Thank you so much for joining us today.
Yeah, sure. Thank you. Have a good one. Bye.